All right, if you're gearing up for the NCLEX, you know the GI section can feel like a total minefield. Well, today, we're going to give you the map to get through it.
Let me tell you a core truth that most study guides just totally miss. The NCLEX doesn't really care if you can name a symptom. It wants to know if you can see the disaster before it happens. Look, out on the floor, and for sure on this exam, your ability to spot these major complications before they spiral out of control, that's what separates a stable patient from a full-blown crisis. So, you have got to stop memorizing endless lists of symptoms. Seriously, you're studying for the wrong test. The NCLEX demands clinical judgment. It's all about making the right call when that clock is ticking.
And hey, this isn't just another boring study guide. This is a sneak peek, a preview of a framework that turns all that GI chaos into pure clarity. We're going to show you exactly how Exam Coaches does it.
So here's our game plan. First, we'll nail down why so many of us get stuck on GI. Then, we'll pull back the curtain on the framework that simplifies it all. We'll apply it to the upper GI, organ emergencies, and the lower GI, and then we'll bring it all together.
Okay, let's dive right in. Why is the GI section such a huge hurdle for so many nursing students?
Does this look familiar? I bet it does. It's so easy to get lost in the weeds, right? Trying to tell the difference between gastritis and ulcers, or maybe missing those super subtle early signs of pancreatitis that are basically screaming emergency. So many people just memorize lab values but then can't connect them to the ticking clock of a real patient. And that's exactly where you lose points.
So, here's the bottom line. The exam is built to see if you can spot a patient who's about to go downhill and then, act safely. It's about taking action, not just listing off conditions.
So, how do you actually train that clinical judgment? Well, you need a system. You need a framework that cuts through all the noise and helps you zero in on what's actually going to save your patient and your score.
So instead of just a random jumble of diseases, Exam Coaches organizes them into this really logical structure. What you're seeing here isn't just another study guide, it's a roadmap for your brain, connecting conditions to their most dangerous complications.
Okay, let's start up top with the upper GI tract. This is where everyone gets confused with GERD, gastritis, and peptic ulcers. The framework helps you filter them out by focusing on key differences, especially pain.
Now check this out. What's so cool here is how one tiny detail, the timing, can point you exactly where you need to go. A gastric ulcer, that hurts pretty soon after eating. But a duodenal ulcer, the pain hits way later and weirdly enough, can actually feel better with food. This isn't just random trivia, it's a critical assessment clue.
But listen, knowing the type of ulcer, that's just step one. Step two is recognizing the biggest, scariest threat, bleeding. The NCLEX fully expects you to immediately connect signs like vomiting blood or those dark, tarry stools with systemic signs of shock, like a heart rate that's climbing and blood pressure that's dropping. That is the unstable physiology you have to catch.
So let's put this into practice. Think about it. Pain that gets better with food, that points you toward a duodenal ulcer, right? So what's the big complication that should pop into your head? And what sign would you check for first? That is NCLEX level thinking.
Okay, now let's build on that. When we move to the accessory organs, the framework shifts our focus to two other massive emergencies, infection and obstruction. This is where we see stuff like cholecystitis, hepatitis, and pancreatitis.
And this is a perfect example of how the framework zeroes in on those high-yield, super-specific signs. A positive Murphy sign for the gallbladder, jaundice for the liver, and for the pancreas, you've got those classic bruising patterns, Cullen's or Turner signs, which are just huge red flags for internal bleeding. These are the kinds of signs that separate a good nurse from a great one.
All right, here's another one for you. That trio of symptoms, right upper quadrant pain, fever, and jaundice, that just screams biliary obstruction. So what is your immediate priority? What are you going to do before you even think about calling the doctor? The framework trains you to make that first, safest move.
Let's keep moving on down to the lower GI tract. Down here, the framework pivots our focus again, this time to the risk of rupture and bleeding, especially with something like appendicitis.
With appendicitis, it is all about recognizing that progression towards a rupture. Rebound tenderness, that tells you the peritoneum is getting angry. A high white blood cell count confirms there's an infection.
But that sudden relief of pain, that's the most tricky and dangerous sign of all. It usually means the appendix has burst, and your patient is on a fast track to peritonitis, which you'll spot with that classic rigid, board-like abdomen.
Okay, last little pop quiz here. These are the classic early signs of appendicitis. What is the one assessment you absolutely have to do first to figure out if this is becoming a surgical emergency right now? Your ability to answer that is exactly what the NCLEX is testing.
So you can see the pattern, right? From the esophagus all the way down to the colon. It's not about memorizing a bunch of random facts. It's about applying a principle of safety and prioritization every single time.
It all boils down to this really simple 3-step process. And this is the key to every GI question you'll see. First, you spot the complication. Is it a bleed, a rupture, an obstruction? Second, you act to stabilize them. And third, you know exactly what to monitor to make sure what you did is actually working.
And that, right there, is the fundamental difference. We don't just dump a list of diseases on you to memorize. We train you to see the complications before they even happen.
We train you to pick the safest, most effective interventions every time. We train you to think, to prioritize, and to act like a safe, competent RN, which, at the end of the day, is the only thing the NCLEX is trying to measure.
This has just been a little taste of the clarity and confidence this method can give you. The complete, in-depth gastrointestinal framework with all the details and all the rationales is waiting for you inside the Exam Coach's platform.